I'm going to talk about the physical examination of the patient with lumbar stenosis or neurogenic claudication. So initially we start with observation. You want to see if the patient is using a cane to walk, a walker to walk, what their posture is like, if they're excessively bending forward to be more comfortable, if they have a lot of pain as they walk. The next thing is to assess their sensation in the legs. Then we also check their strength, their reflexes, palpate the spine, check for hip and knee movement, as well as a quick hip and knee exam to make sure that the problem is not related to a hip or a knee problem. And then finally some special tests that I will go over. So here, as a reminder, are the dermatomes. For patients who have a deficit in the L1 distribution, they'll typically have pain or numbness more in the proximal thigh, maybe even the groin. L2 is typically a bit more in the middle of the front of the thigh, middle of the anterior thigh. L3 maybe a bit more distal. Thigh, again, anterior thigh, sometimes going towards the medial thigh as well. L4 can go to the anterior thigh as well as goes below the knee, more towards the mid-calf region, sometimes towards the ankle. L5, patients will get pain that goes, again, more distal to the leg, to the knee, and also towards the dorsum of the foot, sometimes towards the big toe. And then patients with S1 symptoms will have pain more so in the back of the thigh, back of the calf, and the sole of the foot. In terms of strength testing, we check for hip flexion, which can be from L2 or L3. Check for hip abduction, also which can be from L2 and L3. Check for knee extension, which is typically from L3, L4. We check for the ankle dorsiflexion, tibialis anterior, which is from L4, L5. We check the big toe extension, as well as the gluteus medius, which is the hip abduction, which can be L5. And then the last one is the plantar flexion of the foot, or the gastrocsoleus, which is typically S1. We check the reflexes, which typically the patellar tendon reflex is L4, and then the Achilles reflex is S1. Patients with spinal stenosis can have decreased reflexes depending on the distribution that's affected. The special tests for this typically includes testing the peripheral vascular status as well, because the main thing we want to make sure is not causing the symptoms is really vascular claudication when we are checking for neurogenic claudication from lumbar stenosis. So in this case, you will check the distal pulses of the patient, and then you will also check the ankle brachial index to make sure that the patient's symptoms are not because of a vascular problem and are in fact because of stenosis in the lumbar spine.